A lot has been said about the compromise in his bill as opposed to the House bill. A lot of Democrats think they gave up too much leeway to opposition in the Senate. What are your thoughts on some of the compromises that have to be made in the Senate? And furthermore, what do you anticipate in the conference committee upcoming?
Well, if you can imagine a stadium with 310 million Americans, with the president down at the center, asking his attendees, all 310 million of them, what they think we ought to do about health reform. You can only imagine the cacophony of voices and the difficulty in reaching consensus. But that's really what happens on the floor of the House and Senate every day. 535 people representing those 310 million people with every view from far right to far left. And so reaching consensus is never easy. I think that finding common ground, even in the best of circumstances, is very difficult. I helped found the Bipartisan Policy Center with Bob Dole and George Mitchell and Howard Baker. And we all wanted to get to yes, and it took us over 18 months to do that on a health reform package that I look back on with some satisfaction and some degree of pride because we were able to do it. But again, we didn't feel the political pressures, and we probably are more representative of politics in the middle than you might have with the Congress itself. So it's difficult in any circumstances. Am I disappointed with some of the compromises? Of course, but I think that to make the perfect to the enemy of the good would have been an even bigger mistake, and I'm glad that they got to this point. This is historic. The first time in history of this country that we've passed comprehensive health reform through the House and through the Senate. So I'm very, very pleased with the progress and just hope now that we can finish the job. The majority of people in Massachusetts support health reform. Ironically, Massachusetts is the only state that has passed comprehensive health reform, providing universal coverage for all of their citizens within the last 5 years. So I believe that it would be a huge mistake to interpret this election as a referendum on health reform. In fact, the Republican candidate voted for the Massachusetts plan for health reform as a state legislator.
Did the character of this debate ever surprise you? Early on, we've had episodes like the death panels, the episode and stuff like that. Were you surprised at some of the animosity at times that was characterized by this debate?
I'm not surprised by it. I'm disappointed by it. We've gone through very contentious, very controversial, very confrontational debates throughout history, whether it was civil rights, the Vietnam War. We had the famous caning incident where Charles Sumner was actually caned virtually almost to death in the U.S. Senate in 1856. So we've had occasions throughout history that have been every bit as contentious. It's disappointing anytime it happens. I think that there are understandable and deep-seated differences ideologically when it comes to the role of government in health care in this country, and that has generated a good deal of this. Unfortunately, I think it's exacerbated by the bloggers and by the people in the media, by not the bloggers, by some bloggers and by some in the media, especially cable media, that really create difficulties for the American people in trying to discern fact from fiction.
You were around when 1993, when these reforms were going on too, and you failed under much scrutiny and much debate. And now in 2009, 2010, we are seeing a lot of the similarities and some differences. Can you discuss a little bit, as being a part of both processes, what you've seen similar, what have you seen that's different with it, besides the progressive result as right now, just the process? What are you seeing that's different, and has Congress learned anything? Not so much learned, but has the process run smoother? Can you discuss that a little bit?
Well, I guess I would just, there are many, many differences. I'd cite three big ones. First was the process. The president in 1993 laid down a very comprehensive and detailed piece of legislation, 1,342 pages. And And I think there was some misunderstanding about the degree to which that bill should have served as the vehicle. And I think that created some of the challenges that we faced in the early days. The second thing that was substantially different was that most of the stakeholders in 93 and 94 were in opposition. Most of the stakeholders today are supportive. In fact, I just talked to the president of one of the largest healthcare companies as I was coming down to Florida, who again reiterated his strong desire to see this through and to make sure that it is finished successfully. So that's the second difference, the stakeholders. I think the third big difference is the degree to which the Republican Party has chosen not to participate this time. Back in 93 and 94, you had very solid Republican bills. I would have, now looking back, I would have jumped at the chance to vote for the bill offered by Senator John Chafee, and Bob Dole was a co-sponsor of that bill. This time, the Republicans have just, across the board, decided that they are not going to participate, and so that also is a big difference. One of the biggest similarities is the degree to which healthcare had to compete with a lot of other issues. This time, the healthcare reform package is competing with the economy, with two wars, national security, just an array of financial reform in particular. Last time it was NAFTA and the budget and other issues that kept us from getting to the legislation. I think we learned the lesson this time that we had to stay focused, and by and large, and they've been criticized for it to a certain extent, they have stayed focused, kept their focus on health reform, showing some discipline that I think has made a big difference.
You said that.
Well, I think most of the stakeholders know that we're on a path in health in this country that is completely unsustainable. Costs, access, and quality have all suffered dramatically. The per capita cost for health in 1993 was $3,400. The per capita cost for health in the year 2009 exceeded $8,000. So we've seen more than a doubling in the last 15 years, and they fully expect that the cost in the next 15 years will surpass $16,000 per capita in taxes and premiums and out-of-pocket expenses. We had 33 million uninsured in 1993. Now we have 50 million uninsured. Our quality rank was about 15th in 1993. Today it's 37th, according to the World Health Organization. So we've seen a dramatic decline in circumstances in cost, access, and quality, and most of the stakeholders appreciate how completely unacceptable and untenable it would be were we to wait another 15 years to address it again.
However this debate plays out, do you think it's going to color other elements of the administration's agenda or other subjects? Is there any lasting animosity or threat to bipartisanship?
Well, I'm very troubled by the lack of bipartisanship. I think things continue to worsen in some respects with regard to our ability to bring people back to the middle. That polarization has created almost the perception of dysfunctionality, that we're not capable of addressing some of the most important issues of our time, in part because we can't find the necessary support on both sides of the aisle to do it. And that's very, very troubling as you look to the future. We can't be the leader of the world and not show by example that we're capable of addressing some of the most profound issues of the day: healthcare, the economy, education, climate, energy, financial regulation, and infrastructure. I mean, there's just a list of issues that perhaps fill as full a plate as any I can think of in public policy, and those issues only get more complicated, as I just described with healthcare, the longer we delay.